The House will come to order. Prayer by the chaplain.
Spirit of life, after what has felt like a long and hard winter, we welcome the vernal equinox today, and we give thanks for the wonder of the seasons. We pray for these legislators and staff who work throughout the seasons of the year to show care for Minnesota's rivers, soils, air, trees which sustain us. Bless them as they deal with people who face floods, storms, weather damage. Bring your guidance in this place as these leaders care for people in our state through the seasons of life, too. From prenatal care to early childhood opportunities, from overseeing different education needs in Lincoln County, Beltrami County, and Hennepin County, to the care of seniors who have brought us this far. Spring is coming, O Spirit of life, and so focus us on extending the goodness of life to neighbors and all who draw breath. Pour upon these leaders wisdom, compassion, and energy for the doing of their tasks, and at the end of the day, let them rest in your grace, surrounded by the love of others. Amen.
The chaplain for today is Reverend Hans Jorgensen, St. Timothy Lutheran Church, St. Paul, Minnesota. Pledge of Allegiance. Please remain standing and recite the Pledge of Allegiance to the flag of the United States of America.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
The clerk will take the roll. The clerk will close the roll.
I'm sorry. Yes.
A quorum is present. Members, please take your conversations off of the House floor into the alcoves or the retiring room. The clerk will read the journal of the preceding day.
Journal of the House 91st Session 2019, 23rd day, St. Paul, Minnesota, Monday, March 18th, 2019.
If there is no objection, further reading of the journal will be dispensed with, and the journal will stand corrected as approved by the Chief Clerk. Hearing no objection, the journal is approved as corrected by the Chief Clerk. Reports of standing committees and divisions. A copy of this order of business has been placed on each member's desk. If there is no objection, the reports will be adopted. Hearing no objection, the reports are adopted. Second reading of House files.
Second reading House File number 85.
Second reading.
Second reading House File 286.
Second reading.
Second reading House File 495.
Second reading.
Second reading House File 682.
Second reading.
Second reading House File 1065.
Second
Second
reading.
reading House File 1386.
Second reading.
Second reading House File 1408.
Second reading.
Second reading House File 1571.
Second reading.
Second reading House File 1882.
Second reading.
Second reading House File 1883.
Second reading.
Second reading House File 1960.
Second reading.
Second reading House File 2051.
Second reading.
And second reading House File 2154.
Second reading. Introduction and first reading of House files. The following House files have been offered for introduction today. The Chief Clerk will report the House files and give them their first reading.
Introduction and first reading of House Files 2603 through 2637.
First reading House files 2603 through 2637. Report from the Committee on Rules and Legislative Administration.
Winkler from the Committee on Rules and Legislative Administration, pursuant to Rules 1.21 and 3.33, designates the following bills to be placed on the calendar for the day for Thursday, March 21st, 2019, and establishes a pre-filing requirement for amendments offered to the following bills. House File numbers 10, 679, 680, 892, and 1503.
Motions and resolutions. There are copies of the non-controversial motions at the House desk and online. If there is no objection, we will take action on these motions first. Hearing no objection, the motions prevail.
Detmer moves that House File number 492, now on the General Register, be re-referred to the Committee on Ways and Means.
The member from Washington, Representative Detmer, to your motion.
Yes, Madam Speaker, that is my motion, and both chairs and both committees agree there was a clerical error, so this is something we need to do. Thank you, Madam Chair, Speaker.
Thank you. Any discussion to the Detmer motion? Seeing none, all those in favor, please say aye. Those opposed, please say no. The motion prevails.
Murphy moves that House File number 2387 be recalled from the Committee on Government Operations and be re-referred to the Committee on Taxes.
The member from St. Louis, Representative Murphy, to your motion.
Thank you, Madam Chair, or Madam Speaker. That is my motion, and I understand the Tax Committee wants to see that bill.
Any discussion to the motion?
Madam
Member
Speaker,
from Fillmore, Representative Davids.
maybe if the author that's making the motion explain what the bill does, and if she's talked to both chairs, I'd like to know what this bill is.
The member from St. Louis, Representative Murphy.
Thank you, Madam Speaker. Representative Davids. Page 1, a bill for an act. This bill should go from government operations to taxes. It's a good bill.
Madam Speaker?
Representative Davids.
If my dear good friend from the North Country would yield for a question, what is it?
She's not yielding, I don't think, Representative Davids. Unless I'm misreading her body language. I am
Madam
not.
Speaker,
Representative Davids.
To my, no, she's still my friend. No. To my good friend from the North Country, it just saddens me. It causes my heart more pain than my heart can bear. I'm going to have to oppose this motion, but it really won't matter.
The member from Hennepin, Representative Freiberg, to the Murphy motion.
Thank you, Madam Speaker. To Representative David's questions, this is a para bill. The short description of it is Public Employees Retirement Association increased employer contributions, funding from state aid to local governments extended. Certainly sounds like an appropriate bill for the Taxes Committee. I did know about this motion and have no problem with it. And I would encourage a green vote.
Did the tax chair want to say anything? No. Representative Davids.
The former one does. Thank you, Madam Speaker and members. Because of that explanation, I'm proud to announce that I'm supporting the Murphy motion.
Any further discussion on the Murphy motion? Seeing none, all those in favor, please say aye. Those opposed, please say no. The motion prevails.
Pursuant to Rule 4.30, Davids moves that the rules be so far suspended that Senate File Number 761 be recalled from the Committee on Ways and Means, be given its second reading, and be placed on the General Register.
You know, I thought he said Dames, not Davids, and I was very confused. Representative Davids, to your motion.
Well, thank you very much, Madam Speaker. And this moves a bill out of HHS, or basically out of Ways and Means, because HHS is a division of Ways and Means, to the House floor. Senate File 7061 passed the Senate over a week ago with a strong bipartisan vote. So we have this bill over here. The House version of the bill, House File 629, received strong bipartisan support in a very thorough hearing in the Commerce Committee, 17-2. So it's ready for prime time. It passed the Commerce Committee 17-2. This House version of the bill has been sitting in HHS Finance since February 14th. Yesterday, my good friend from Olmsted, she will not be hearing the reinsurance bill in her committee. And remember, she has every right to do that. I probably hold the record for most bills killed by being held by a chairman of anyone on this floor, would be my guess. So that you certainly have the right to do that, but we as a body have the right to get this very important bill to the House floor. Commissioner Kelly said that rates would be higher with Governor Walz's 20% subsidy than they would be under reinsurance. Their stated intention, which was very frightening to me, was to raise rates to game the federal funding to make sure MNsure gets a bigger piece of the pie. Now, what can possibly go wrong there? We have set up a perverse system where MNsure wants constituents to pay higher rates. That's just wrong, members. My constituents don't want higher rates. Reinsurance worked. My constituents would rather trust a program that has been proven to work than to take a chance on a completely new scheme like Governor Walz's plan. Some have been saying that Governor Walz's plan is just like the one we did in 27 with members. It is not. It has not had a hearing. The 20% bill has not had a hearing in this body. He gives millions of dollars to MNsure to do a giant IT buildup over 5 months and would hire 51 people to write checks out to insurance companies. That's not what the reinsurance bill does or did. So he wants 51 employees to write checks out directly to insurance companies. Well, we're getting the old band back together. Commissioner Lori, MNsure, Minute. What could possibly go wrong with that? At the end of the day, this is about helping Minnesotans. I'm asking you to join us in getting this done. It does not require, we can move this reinsurance forward for the years 2020, 21, and 22. It does not require any new state funds being appropriated. It includes the extra reporting requirements that Chair Halverson so wisely recommended. They're in the bill. We put a very, very good bill together in the Commerce Committee. And basically, we're reestablishing some money back in the Health Security Fund. So members, it's time now. And Madam Speaker, I'd ask for a roll call.
Representative Davids requests a roll call. Seeing 15 hands, there will be a roll call. Representative Davids.
Thank you, Madam Speaker. We need to get this done. We need to do it now, and I'd appreciate member support.
The member from Olmsted, Representative Liebling.
Well, thank you, Madam Speaker. Representative Davids, I'm so glad you brought this up. Even though we weren't going to hear the bill, in fact, we heard the bill as an amendment last night, and it was defeated soundly in the Health and Human Services Finance Committee on a vote of 11-4. And I would say that it was a bipartisan vote against the bill. So Madam Speaker, even though, clearly I'm going to ask members to vote against the suspension of the rules, I do think I should respond to just a few of the points that Representative Davids made. First of all, saying there's no new money, it's like saying I've got my money, I put it on the credit card, but so then when I really haven't spent anything because it's on my credit card. This is a program where even though the money hasn't actually gone out yet, it's been spent. A lot of money has been spent. So no one should be saying there's no money here or that no money's been spent, which I have heard that said a number of times. In terms of Representative Davids talked about the rates going up and that Commissioner Kelly, what we need to pay attention to is what people pay. So the nominal rate really doesn't matter. What really matters is what are you going to pay out of your pocket for your insurance. And under the governor's proposal, which is not before us right now, but this is we had a very thorough examination yesterday in our committee of the reinsurance program and the possible alternative to the reinsurance program, which is the governor's idea for a 20% discount for the consumer. So you can either give the money to the insurance companies and hope that they will follow through and pass it along to the consumer, or you can actually give it to the consumer as a discount right off the bill so that each person sees that they're getting the 20% discount. That is what is being proposed here. And so sure, you have to backfill, the state would have to backfill that money, but the consumer and every single consumer who's in the individual market would get that 20%. You cannot say that about the reinsurance program. Some people's rates actually went up. Some people actually paid more under reinsurance than they did before. And the problem is the big 20% discount or reduction that everybody likes to talk about was an average. So really good for some, really not so good for others. The governor's plan actually makes it certain, and each consumer will be able to see exactly what they're getting. So those are just a couple of the reasons that members should vote this down. We had a thorough hearing on it, even though we did not have the bill before the committee. When the Republican members brought it up as an amendment later on, it was thoroughly defeated in the committee. So Representative Davids, I appreciate you saying about all the bills you killed. I would say that, in fact, the Republican members kind of killed this one by bringing it up as an amendment.
The member from Goodhue, Representative Haley.
Thank you, Madam Speaker. And members, Chair Liebling and Representative Davids. It was my amendment in the committee last night, and I take issue with Chair Liebling's representation of what happened in committee. That we were not given a thorough examination of reinsurance. We were given a thorough presentation by the governor's commissioners on their program and contrasted ever so slightly their objection to reinsurance. In fact, when I questioned Commissioner Kelly on a few of his slides, he agreed with me, and you can find this on tape, he agreed with me that, in fact, the slides did not tell the full story. We were not allowed testifiers. We were not allowed presentation on our bill. We inserted an amendment in protest, frankly, that we were not given an opportunity even for more than 15 or 20 minutes to question the commissioner's presentation. We were given no opportunity to thoroughly discuss reinsurance. Thank you, Representative Davids, for bringing this forward, and I am in support of your motion.
The member from Olmsted, Representative Pearson. Further discussion. Representative Davids.
Thank you, Madam Speaker. I'm a bit amused by some things my good friend from Olmsted said. Said it was a bipartisan vote. There's not one member in my caucus that voted the way you said they did. Not one. Now, I don't know what the definition around here is anymore, bipartisan, but of our 55 members, they all voted for the amendment. And as far as a thorough hearing, one question apiece? A thorough hearing, one question apiece? Chair Marquardt, how would that work this morning on the tax haven bill? That was not a thorough hearing. It was a thorough lecture. Vote green. Thank you.
The member from Stearns, Representative O'Driscoll.
Thank you, Madam Speaker and members. Today is March 20th. In addition to it having been my father's 83rd birthday, it also marks 60 days, 2 months from the time that this place is going to be adjourning. 2 months, folks. We've been here over 2 months. Just about everybody in this chamber had heard on the campaign trail about how important insurance is. Matter of fact, some people lost their seats because of that on both sides of the aisle. And what are we doing here? We're trying to bring insurance, something we know that works. We've got a federal waiver on it. Doesn't cost the state any more money that's already been appropriated, and there's federal money to come and help. This seems to be a no-brainer in the three-legged stool of how we resolve this issue. If we don't do it today, when are we going to do it? In the dark of the night? In some omnibus bill? As a part of other things? I don't know. But I do know that I have people in my district who wrote me as recently as yesterday, please, please help me with my insurance needs. And I tell them I'm fighting every day for you. I'm the Republican lead on the Commerce Committee. I bring it up regularly. Representative Liebling and I have had some heated discussions in committee regarding this as she's been in the Commerce Committee. I can't be any more plain and obvious of what my desires are. We need help in Minnesota. This body owns it right now. This body owns the outcome of insurance and the reinsurance program. The Senate did their job. They sent it over and said, hey, we want to help those folks who are the most vulnerable. They don't have group insurance. They don't have insurance through an employer. They may be between employment and maybe a small and upcoming employer, and this is how they get their insurance. These are the people we're trying to help. These are the Minnesotans that I am trying to help every single day in this chamber. And I would ask, take off your hardware, lay it on the desk, vote green, and let's get this thing to conference committee. It's for the good of Minnesota. These are Republican, independent, Democrats, moms, dads, children, grandparents. They need our help. Vote green. Thank you, Madam Speaker.
The member from Isanti, Representative Dowd.
Thank you, Madam Speaker, and thank you, members. Representative Liebling, Chair Liebling, you said something I think that was very dangerous here on the House floor. You actually said that there are people whose rates and cost for health insurance went up because of reinsurance. And that is not accurate. And if I am wrong, and I'll give you a chance to yield for a question, and I'm not talking about their rate from the previous year to the next year, I'm talking about their rate with reinsurance versus their rate without reinsurance. Because the way that you said it implies to people that their rates went up. And I'm going to explain to you what the law of average is right now. Because you were correct when you said that the rates on average were reduced by 20%. So that means if somebody's rate actually went up as a result of reinsurance, that there's another person whose rate was lowered by 40%. That's what an average is. The average was 20% reduction, okay? And I think that I don't think you intended to mislead people, but I think people at home listening and people in this chamber listening think that somebody's rates went up because of reinsurance. And I think that's a very dangerous thing to say. Would Representative Mann yield for a question?
She will yield. Representative Dowd.
Thank you, Madam Speaker. You know, this is a very important issue, and I happen to know because I knocked on some doors in your district, so I happen to talk to some of your constituents. Was reducing health insurance costs and reducing healthcare costs, a big issue with constituents in your district? Was that something very important to your constituents?
The member from Dakota, Representative Mann.
Thank you, Madam Speaker. Representative Dowd, yes, that was a very big issue. What was not a big issue for them was us as a body giving money, taxpayer money, to insurance companies. as a giveaway with no strings attached to say, here, please lower our premiums. We hope that you'll do it, but we don't know if you actually will or not. And in fact, some insurance companies didn't do that. So lowering healthcare costs and access to care was certainly very important in my district. Giving away money with no strings attached to companies who are benefiting off the back of sick people in our communities was not important to them.
Representative Dowd.
Thank you, Madam Speaker. And I appreciate your passion, Representative Mann. I'm not sure that has happened. We've got a couple of options before us. We've got a proven one in reinsurance that has reduced rates. Do you know what the impact was of rates under reinsurance? Do you know how much it reduced rates for Minnesotans, for your constituents, if she would yield for a question?
She will yield. Representative Mann.
Thank you, Madam Speaker. Well, I think we've heard many times already that the average was about 20%. And you're right, an average is an average, meaning that some people's insurance went up and others went down. So it was not something that was solid across the board, right? So if we have a program like the subsidy program where everyone will get 20% reduction, and we know that everyone will get a 20% reduction, that program is actually significantly better than just an average of 20%.
Representative Dowd.
Thank you, Madam Speaker. And I appreciate that for saying that I am right, because I am right. The average was a 20% reduction. And the program worked. So I appreciate you admitting that the program worked and that I am right. So we have two options before us. We have a proven system that has reduced rates. We also have insurance companies now that are telling us that rates could increase. If we don't renew this reinsurance program, that rates could increase as much as 50%. And then we have the governor's plan, which is a 20% premium reduction, just straight across the board. So what is your plan? If you don't support the reinsurance, which I'm gathering from your comments that you don't support the reinsurance program, what is your plan? Do you support the governor's plan, if she would yield?
She will yield. Representative Mann.
Thank you, Madam Speaker. Representative Dowd, I support a plan where we know that every constituent and every person who is on the individual market will get a 20% reduction. I absolutely support that plan. I do not support a plan where, again, we give companies who are benefiting off sick people in our communities and we tell them, do whatever you want with that, and you may or may not decrease the premiums. I don't support that.
Representative Dowd.
Thank you, Madam Speaker. If she would continue to yield.
She will yield.
Thank you, Madam Speaker. So do I understand you correctly that under the governor's plan, everybody on the individual marketplace will see a 20% reduction?
Representative Mann.
Thank you, Madam Speaker. That is the goal of the plan, Representative Dowd.
Representative Dowd.
Thank you, Madam Speaker. You are wrong. Because under the governor's plan, only people who buy their insurance through MNsure will get a 20% reduction. Other people who buy their insurance in the individual marketplace will get screwed. That's what happens under the governor's plan. So I heard you, I want to ask if I heard you correctly as well, that you don't support a plan that gives checks to insurance companies, that just gives checks to insurance companies, if she would yield for a question.
I would like to remind the body that it is the matter in dispute and not personalities, so that we should be keeping our remarks confined to the subject matter and not individuals in the debate. Representative Mann, will you yield? She will. Representative Mann.
Thank you, Madam Speaker. Representative Dowd, I'm not quite sure how to make this any more clear for you. I do not support us giving money with no strings attached to insurance companies and saying to them, you may do with this what you will. Because that's what we did, and we saw premiums go up with that plan. Some went down, some went up. So I do not support giving money, again, just so we're clear, with no strings attached directly to the insurance company. Now, I support a plan where they are paid for their services, and we know what services those are, and we know what we owe them. That's a whole nother story. That's paying for a service. Good.
Representative Dowd.
Thank you, Madam Speaker. Representative Mann, under the governor's plan, they're going to hire 51 additional people to write checks to insurance companies. So I join you that I don't think that's a good idea. I think we should use the proven plan that already worked to reduce premiums for people in your district by 20 percentage points. Would Representative Christensen yield for a question?
She will yield. Representative Dowd.
Thank you, Madam Speaker. Representative Christensen, was health care costs and health insurance costs an important issue in your district to your constituents?
The member from Washington, Representative Christensen.
Thank you, Madam Speaker. Absolutely, yes, they were.
Representative Dowd.
Thank you, Madam Speaker, and I'm glad to hear you say that because they were in mine too, and I'm sure your constituents are as happy as mine that reinsurance was so effective at reducing their rates. Do you agree with presidential candidate Amy Klobuchar when she said that it was that when she praised reinsurance and said that it was so great and should be passed on the national level? Would you agree with her if she would yield?
The measure before the body is David's motion on suspension of the rules to take up reinsurance immediately. Representative Christensen.
Thank you, Madam Speaker. Representative Dowd. I agree with Representative Mann, and I agree with what she stands for today. That's where I stand. Thank you.
Representative Dowd.
Thank you, Madam Speaker. You know, members, this is something that we can't wait on. That's why we have a motion before the body to put this on the General Register. By the way, the motion isn't to bring it up for immediate consideration. It's just to move it to the General Register. Because we have committee chairs that won't even move the bill out of their committee. And what's the alternative? An unproven plan by the governor that, by the way, was introduced on March 11th that hasn't had a hearing in this body yet. And if Representative Christensen would yield for another question.
She will yield. Representative Dowd.
Thank you, Madam Speaker. Representative Christensen, I don't know, I guess, if you sat on these committees that heard this last night, but are you aware that Commissioner Kelly actually said that rates would be higher under the governor's plan than they would be under reinsurance? Are you aware he said that in committee last night?
Representative Christensen.
Madam Speaker, Representative Dowd. No, I'm not. I do not sit on those committees.
Representative Dowd.
Thank you, Madam Speaker. If she would yield for one more. Do your constituents want higher rates? Is that what they want? Do they want their health insurance rates to go up, if she would yield?
Representative Christensen.
No, they don't. And the reason I was elected in my district is because I stand for Representative Mann's plan. Thank you.
Representative Dowd.
We need to have some hearings. We need to have some hearings on these bills, members. We need to have some discussion and debate here on the House floor about these bills. Because you are standing here telling me that you support something that will increase rates for your constituents. And you were on the campaign trail telling your constituents that you wanted lower rates. That's why this motion is important. You don't understand what we're doing here. The commissioner in committee last night said that the rates would be higher under the governor's plan. Under the governor's plan, they want to hire 51 people to write checks to insurance companies. And they want to create a whole new system over at Minute to administer this. I appreciate former Chair David's confidence that that would go off without a hitch. But based on the record of Minute and Minsure, I would rather stick with something that's proven, not with something that's almost guaranteed to fail. And we know from the commissioner that is guaranteed to increase rates for our constituents. I bet if I could say in this chamber, how many of you campaigned on lowering health care costs and rates for your constituents, every single hand in this chamber would go up. But when I ask you to compare this, which has a proven track record, reinsurance, a proven track record of lowering rates for Minnesotans, 20% on average. By the way, you cannot say that a single person's rates went up as a result of reinsurance. You can say that somebody paid more under reinsurance, but it's not as a result of reinsurance. And there's a big distinction there. And I believe that you misled people when you said that in this chamber, Chair Liebling. But I appreciate you correcting the record when you said on average rates went down 20%. So some people less than 20% and some people a lot more than 20%. I assume because the insurance companies kept their word and they reduced the rates when we passed that program, that you also understand when they say rates could go up as much as 50% if we don't reauthorize the program, that we would take them at their word. And what's your plan? Increase rates 50% and then lower them 20%. That sound like a winning equation for Minnesotans? Because that's the governor's plan. Increase rates 50% and then lower them 20%. Sounds like political speak to me. We can't sit on our hands in this chamber any longer. Minnesotans can't afford the higher rates that you are going to force on them if you pass the governor's plan. That's not my opinion. That's the governor's commissioner last night in committee when he said that rates would go up under the governor's plan over what they would be under reinsurance, that they would be higher under the governor's plan. Those aren't my words. That's the governor's own commissioner. But we're going to lock these bills up in committee and not give them hearings. The governor's plan hasn't even had a hearing yet. And it sounds like that's what you support. I can't wait till it gets a hearing so you can learn all the stuff that I have learned because I've dug into it. If you don't support giving checks to insurance companies, you certainly won't support the governor's plan. 51 additional people just to write checks. How many checks need to be written that we need 51 people to write them? Checks to insurance companies. To increase rates for Minnesotans. Sounds like a great plan. It kind of reminds me of the governor's gas tax plan, where only half the money goes to roads and bridges. The other half goes for fraud, waste, and abuse at DHS. Guys, we're actually doing things to try to help Minnesotans here. And it's not always easy. It's not always easy to be in the majority. Not everybody on my side of the aisle supported reinsurance or thought that it was going to be a great thing when we passed it. You know what? It turned out that it worked really, really well. And it became a national model. And even people like Amy Klobuchar now think that it was so successful it should be passed at the national level. We saved the individual marketplace. Now, of course, we have rules here that I could never question your motives. But I will tell you, at times I've wondered if MNsure wasn't designed to destroy the individual marketplace on purpose so that we could move to a government-run healthcare system. That thought crossed my mind. And you know why? Because sometimes I think about it and I try to reverse engineer it in my head. Instead of just, sometimes we come up with a solution here in this chamber or in this body. And through the process, if you weren't involved in the process, because I don't sit on those committees, I look back and I say, if I actually wanted to design a system to destroy the individual marketplace, could I have designed something that would have worked better than MNsure to destroy the individual marketplace? I'm not sure I could have. I'm not sure I could have. So I don't question anybody's motives in this chamber. I wouldn't do that. But Minnesotans can't wait for us to sit on our hands and lock bills up in committee without giving them hearings, without talking about this issue. They're tired of politicians going out on the campaign trail and talking about wanting to lower healthcare costs and lower insurance rates. And then they come here and they stand up on this floor and say that they will support a plan which will increase rates for Minnesotans. Not my words. The governor's own commissioner said that last night in committee. That's what you support? Let's get this bill out of committee, let's get it on the General Register, and let's pass it. It worked. So successfully that it's become a national model. That Amy Klobuchar, Minnesota's favorite daughter, who's running for president, thinks it's such a great idea we should use it nationally. But Democrats in this chamber won't even let the bill out of committee. And they want to mislead Minnesotans into somehow thinking that this raised rates for Minnesotans. That's laughable. That is laughable. You cannot deny the facts. And the facts are that this program was successful. And if you don't like raising rates, then you can't support the governor's plan, because his commissioner last night told us that rates will be higher under the governor's plan than they would be under reinsurance. Madam Speaker, would Representative Katiza-Watun yield for a question?
She will yield. Representative Daudt.
Thank you, Madam Speaker. Representative Katiza-Watun, is health insurance costs and keeping rates low important to your constituents?
The member from Hennepin, Representative Katiza-Watun.
Thank you, Madam Speaker. Representative Daudt, I believe that's a concern for everyone across the state of Minnesota. Yes.
Representative Daudt.
Thank you, Madam Speaker. I'm so happy to hear you say that, because I agree. And I think that is something that we all agree on in this chamber. Madam Speaker, would she yield for another question?
She will. Representative Daudt.
Thank you, Madam Speaker. Representative Katiza-Watun, we've got these two plans, one of them locked up in committee that we can't get out, one that hasn't had a hearing yet. I don't know if you support these. One has been extremely successful, 20% rate reductions for your constituents. I think they've been very happy with that. How do you think we should go about keeping rates low or reducing rates for your constituents?
Representative Katiza-Watun.
Thank you, Madam Speaker. Representative Daudt. I think it's really important that we work to bring all of us together, find something that's going to work for Minnesotans across the state.
Representative Daudt.
Thank you, Madam Speaker. I couldn't agree more. I couldn't agree more. That's why I think it's important that we support something that's proven. Something that we're trying to put on the General Register so we can pass it out to give Minnesotans the certainty they need and deserve. Not some unproven plan. I get worried when people make promises. You know, I was very cautious, and I remember the conversations we had when Obamacare, or MNsure, our version of Obamacare, passed here in Minnesota. I had this job, actually. I was the minority leader. And I thank you for passing it, because frankly, you gave me 4 great years as Speaker, and we got a lot of really good stuff done as a result of that vote. But I'm trying to save you. I'm trying to save you from making that mistake again. And as much as I would like you to raise rates for Minnesotans again and put me back in the Speaker's chair, I don't want you to do that to Minnesotans. It's not worth it. We need to work together. Thank you, Representative Katiza-Watun. You had the right answer. Let's work together to get this done. There is a proven solution that has reduced rates for Minnesotans. I think even better than expected. And we can't wait. And like I said, I get nervous when people make promises, because I remember on this House floor, on the day that MNsure passed, Obamacare here in Minnesota, I remember speech after speech after speech, and Representative Winkler was here at the time, that this was going to reduce costs for Minnesotans, that this was going to give them more choice. That's what you said. Speech after speech after speech. And we said, no, it will not. What was the result? 300% increases in rates. 300%! And I hate the fact that we're celebrating a 20% decrease, but at least we decreased them. But that's what MNsure and Obamacare did to Minnesotans, a 300% increase in rates. And I can't tell you the number of families that I ran into all across the state of Minnesota. One of them, one of the most heartbreaking cases that I ran into was a family of 4 who was quoted $3,000 a month for their health insurance in the individual marketplace with a $13,000 deductible. You do the math on that, that's $50,000 a year out of pocket before they get 1 penny of coverage. That's what Obamacare and MNsure did to Minnesotans. That's what you promised them that day that we had the debate here on the House floor. You know what happened to that family? They dropped their health insurance. They dropped it. They couldn't afford it. That's what you and your promises did to Minnesotans. Now, the governor's commissioner last night in committee promised that under the governor's plan, rates will be higher than they would be under reinsurance. So they've adjusted their promises. I'm glad to hear that. But I can't even imagine how disastrous this will be on Minnesotans. And the inaction of this body to lock this bill up in committee, to not give these bills hearings, to not have this thorough debate. And who waits? That family of 4 that dropped their health insurance, who doesn't have coverage today because of that. And they're waiting for you to take action. And what do we say? Well, we haven't had a hearing yet. Nope, this bill's not getting out of committee. Would Representative Katiza-Watun yield for one more question?
She will yield. Representative Daudt.
Thank you, Madam Speaker. Representative Katiza-Watun, how are you going to respond to your constituents when they ask you why these bills haven't had a hearing and why we have taken no action on this?
Representative Katiza-Watun.
Thank you, Madam Speaker, and Representative Daudt. I do sit on the Commerce Committee, and we did pass the reinsurance bill through the process with bipartisan support. I think that Minnesotans know that we're working every day to do everything that we can to lower health insurance costs and to make lives better for everyone across the state.
Representative Daudt.
Thank you, Madam Speaker. Thank you, Representative Katiza-Watun. You are correct. Reinsurance does have bipartisan support. You know why? Because it works. It's the right answer, it's the right thing to do, and we need to stop sitting on our hands and take action. Minnesotans can't wait. You're going to find out, if you don't pass reinsurance, how much rates are going to go up. Because they have to file their rates as if we had reinsurance and as if we didn't. So you're going to see, and you are taking a very big gamble by not taking action. Because if you don't pass reinsurance, if you keep it locked in committee and vote down this motion to move it to the General Register, you are going to own that 100%, lock, stock, and barrel. You're going to own that rate increase. I'm very thankful to my colleagues over in the Senate who knew that this was important to Minnesotans, who know that the program works, who passed that bill and sent it over. And now it waits. Now it waits for Democrats in the House to take action. The same people who promised that rates were going to go down under reinsurance and promised people they were going to have more choice. And what happened? 300%, not reinsurance, under Obamacare, under MNsure. 300% rate increases and insurers fleeing the marketplace. A lot less choice for Minnesotans. In some cases, no choice at all. Only one insurer in the marketplace. Is that the kind of choice you had in mind when you passed that? Your record is lacking, and your word is lacking, and your trust from Minnesotans is lacking because of your record. It's time to take action. It's time to move this bill out of committee instead of leaving it locked up there, killed by one committee chair. And let's do what's right for Minnesotans and pass reinsurance. I'm not going to ask anybody else to yield. I've got a whole list of names. I'd love to. And I'd love for you to all answer to your constituents why you're not taking action. And whether you're going to support a plan that works or one that their own commissioner says will increase their rates. But sometimes you can talk too much on the House floor. And I know that you've all paid very close attention. And I know that if you haven't dug into this issue, based on our conversation today, you're going to, so that you understand how important this is to your constituents and what the impacts will be on their lives. Because if you don't, question and answer time will be longer the next time. So put up a green vote, let's move this bill to the General Register, and then we'll take action to pass it into law and provide Minnesotans the known, trusted, reliable relief that we know this bill will give them. Not the 50% increase that will happen if we don't do this, and then, oh, by the way, we'll take credit for reducing it another 20%. So raise it 50 and reduce it 20. If that's your plan, God help you and God help your constituents. Because that's not what they sent you here to do, and all of those promises that you made on the campaign trail will be broken. So the decisions we make here are not always easy. They are tough. But your constituents didn't send you here to ignore tough decisions and to sit on your hands. They sent you here to take action. And this is your opportunity to take action. Thank you, Chair Davids. And I'd ask for a green vote.
The member from Blue Earth, Representative Munson.
Thank you, Madam Speaker and members. I felt the need to rise today because we were discussing the bipartisan vote in HHS Finance yesterday against hearing this amendment in committee. And I was the Republican that voted against it. I was talking to Representative Hamilton, who voted against the reinsurance bill when this originally came to the floor. And I do want to say something about what Representative Dowd had said. This reinsurance program was successful in lowering the cost of insurance by 20%. He's absolutely right. Maybe it was an average, but it worked. But it's not a shock when you spend hundreds of millions of dollars to the insurance company with the intention of paying down rates. If you say you want to pay 20% of my dinner bill, and when I get the bill, it's 20% less, that's great, it worked. That's not a success. Paying down the insurance rates with taxpayer dollars, and by the way, these are taxpayer dollars taken from all taxpayers. And these are the private insurance rates, which used to be for 11% of Minnesotans, but people like me in rural Minnesota who had one insurance provider in my area and who raised the rates for my family of four to $26,000 a year in premiums with a $13,300 deductible, almost identical to what Representative Dowd was saying. That was my insurance. And my family opted to go without insurance because that was the bronze plan. The gold plan was $42,000 a year in premiums. This is not sustainable. This is not, you can't tell me these rates are attractive. And even with this reinsurance rate, a 20% buy down on that rate still wasn't attractive for a healthy family to buy. We need better solutions. Now, Representative Dowd's claim that your program is going to raise the rates is absolutely right. It will raise the rates. But the difference is, instead of buying it down on the back end with the insurance company, your plan is to give everybody a 20% off coupon. And in your defense, your program's actually fair because then everyone gets a 20% off coupon. Doesn't mean the insurance companies can't raise the rates in that area a little more, but yours would be a little more fair to people. This plan would be dumping money into the insurance program with less transparency and less accountability. And in both of these programs, we open it wide open to fraud. Now, what I want to say is that the job of the insurance company is to offset risk. That's why we have insurance. Otherwise, we just go and pay our own way. But once in a while, people get caught up in bills that they can't afford to pay, so you buy insurance to cover that catastrophic issue. The reinsurance program takes an enormous amount of risk away from the insurance companies by saying once the person like me paid $13,300 out of my pocket, and then the insurance company covers it between $13,300 to $50,000, then all of the taxpayers pay everything from $50,000 to $250,000. If you're taking away the insurance company's need to offset all this risk, then what is the insurance company doing? They're not doing their jobs. And if you want to talk about socialism and programs that move us towards socialism, let's talk about privatizing the profits of insurance companies, but then socializing the losses. Okay, taking the government and making the government absorb all the losses for insurance companies, that's socialism. And that's destroying the private market. That's where we take the job of insurance companies and we move it into the government. That is a clear way of destroying this private insurance program. And that's what's frustrating to me. I didn't campaign on reinsurance, and I didn't campaign on giving people coupons. I campaigned on free markets and health care, because free markets have been proven for thousands of years to drive down prices based on supply and demand. And when people are mad because their rates go up, they sharpen their pitchforks. Or, they like me, they drop insurance. When you take away someone's mandate that they have to buy insurance, and they drop it, and the insurance used to be 11% of the private market in Minnesota, but people like me got fed up with paying these outrageous rates, we left. And now insurance companies realize their rates were too high. And if we had free markets in healthcare, they would lower their costs to bring us back. But the reinsurance program just dumped a bunch of money in the back door, and you guys want to give everybody coupons paid at the expense of all taxpayers. That's wrong too. We need price transparency in healthcare. We need to allow people to shop outside of their insurance networks where they dictate they go. That's why I am the chief author of the Patient Right to Shop Act, which would bring drastic free markets to healthcare and allow people who are the sickest among us, who have the highest costs of healthcare, to actually shop around and save money. And the insurance company has to give them 50% of the savings. The other 50% goes to the insurance pool to lower the cost for everyone. My bill's held up in committee just like this one. The committee chair sitting on mine used to work for the insurance industry. I was kind of excited about getting a hearing knowing that the Democrats are in charge. But I'm not going to get a hearing either. This is frustrating. And I'm just asking for the right to shop for care. I want price transparency because I know free markets are proven and they drive down the cost of care. Look at LASIK eye surgery. It isn't covered by insurance and people have to pay cash. It used to cost thousands and thousands of dollars, and now it's like $2.99 an eye, buy one, get one free. People have to advertise, people are allowed to shop, people are rewarded financially for shopping. This system works. So I don't believe in reinsurance, and I don't believe in giving everyone a coupon that's paid for a small select group of people that's paid for by all taxpayers. I sat in committee yesterday, and Commissioner Kelly said, I haven't met somebody who doesn't support either one of these programs, so I had to go introduce myself. I support free markets. I door knocked in my district saying, I got a healthcare price transparency bill through that the governor signed that sticks it to the insurance companies and sticks it to the pharmaceutical companies, because this will bring more price transparency by displaying some prices. And they loved that. They love empowering patients, because when you empower patients to shop, then the insurance companies can't buy their way into legislation on either side of the aisle. I'm a Republican. I don't caucus with most of these people because I like different ideas. But this idea of telling you your plan is increasing rates is bogus. Of course, it's going to show higher on the bill, but you get a coupon, you end up in the same exact place. And I don't like people fighting over free dollars. I heard that in committee yesterday. Well, we're trying to maximize the amount of federal dollars for the program. This is our money. This is taxpayer money. It doesn't matter where it comes. And the more money that goes through the government and comes back, the more we increase socialism. Make insurance companies do their job, offset risk. Don't shove it onto the government. Let's expand the private market. Let's have free markets. Let's have a right to shop. This is the way that we lower healthcare costs. And free markets is proven to work. This is one of the last sectors of our economy that we don't have price transparency, and that the less pricing we have out there, the insurance companies will make more money off of it, the pharmaceutical companies will make more money off of it. Let's empower people to make their own decisions, because we have people with high deductibles in my district that are afraid to go to the doctor because they don't know what things cost. So you have insurance, and I hear a lot of people talk about lowering healthcare costs. Everything that was discussed before I stood up wasn't about healthcare costs, it was about health insurance costs. Health insurance is not health care. We are doing nothing about lowering the cost of health care unless we actually talk about price transparency and letting people shop. This is just shoving money around through government and growing government and socializing the system. And I'm saddened to hear this. Thank you, Madam Speaker.
Representative Liebling.
Madam Speaker and members, first of all, thank you, Representative Munson, and I appreciated a lot of what you said, and I appreciate your thoughtful approach to this issue. Although we don't agree on everything, we agree on a lot, and I am happy to continue working with you because we really do share the same goal. I just wanted to rise, Madam Speaker, briefly to respond to some of what we heard because, you know, you can keep talking a long time on the floor, and you can be really loud, and you can get really angry and still not know what you're talking about. And I just wanted to say, I know Representative Schultz, I think, is going to respond to a few items in a few moments, but I just wanted to go back to this issue about did everybody's rates go down? In fact, some people paid more. 60% of people who are under 400% of the federal poverty level actually paid more for their insurance premiums. That is a fact. It is a fact. It is a verifiable fact. And you can yell that it's not true. You can get really mad about the fact. You can go on and keep repeating yourself over and over. It is still a fact. The other thing I would like to point out to people who maybe aren't statistical experts around here is that an average does not mean that the distribution is even so that every high point then represents an equivalent low point, because you might not, you know, an average is where you sum up everything and then divide it by the number of items, right? So it kind of depends on what the distribution looks like. So there was a statement made that if somebody got less than 20, if somebody had 40% reduction that somebody else had, I forget what it was, 40% increase or something. That's not true. That's just not how averages work. So I just wanted to put that out there because we heard a lot of very loud, very angry talk, yelling and going on, and I was getting kind of concerned at one point, I have to tell you. But just because you repeat it over and over does not mean that you understand what's going on and that you have the facts. Thank you, Madam Speaker.
The member from St. Louis, Representative Schultz.
Thank you, Madam Speaker. Well, when I door knocked in my district, what people wanted was access to health care. And it wasn't just people in the individual market that are struggling. Many people are struggling with the cost of health care. And reinsurance does nothing to address the cost of health care. So Representative Dowd may not know this, but we've been meeting on Mondays in a bipartisan way to tackle that issue with Representative Munson, with Republican and DFL senators, with House members. So we are working really hard to try to tackle these issues of health care costs for all Minnesotans. The individual market only covers a very small percentage of people living in Minnesota. We cannot spend and waste our time when we should be in HHS Finance Committee trying to tackle these cost issues and not here on the floor debating reinsurance. Because people don't, it's not that health insurance that matters, it's health care that matters. So the reinsurance bill that was passed allocated $542 million to health plans in this state with no guarantee that premiums would go down. We were trying to buy down premiums for what they otherwise would have been, which is different. They set higher rates. They would have set higher rates without reinsurance. But rates went up for many, as Representative Liebling just stated. And we should not feel threatened by the health plans that rates may go up 50%. That number is based on a consulting report that Blue Cross Blue Shield paid for. It does not compare any of the alternatives we're facing here in the state currently. That is not an accurate reflection of what rates could be. So we should not continue debating this on the floor. We should take these debates and information gathering in committees where we will hear the governor's proposal and other ideas of how to stabilize the individual health insurance market. We cannot go into this technical detail here on the floor today. And we should not feel threatened by what plans are going to do. We have to tackle the underlying problem of healthcare costs. In addition to spending our own money of $542 million, we lost hundreds of millions of dollars of federal money that pays for Minnesota Care. When I was door knocking, I door knocked an older gentleman who had no health insurance, no access to health care, and I told him about our wonderful Minnesota Care program. A few months later, he came to a coffee that I was having, and he started crying because he was so grateful he could get access to health care through Minnesota Care. We lost hundreds of millions of dollars in federal funding from going forward with reinsurance. We have to be more responsible with the state budget and taxpayer dollars. We cannot continue having these destructive Republican budgets put forward. And in the 4 years I've been here, I haven't heard any solid legislation from my Republican colleagues to address the underlying problems of healthcare cost growth. Where are the ideas to do that? We're working really hard, and some of them are price transparency, Representative Munson. It's all about changing the incentives, and those are the projects we're working on in a bipartisan way. And we need to continue those discussions. It's hard work. And at the federal level, we're in this predicament because of what's happening in the federal level, dismantling our individual insurance market. There was federal reinsurance. It's a lot different than the state program, so we shouldn't make comparisons. But because they've eliminated some of those subsidies, that's why we've seen destabilization in individual health insurance markets. And of all the states that are doing reinsurance, Minnesota is paying the most and losing the most in federal funding. So it's not a good situation that we should continue. It was supposed to be a Band-Aid. We are supposed to be tackling the underlying problems. And as Representative Munson said, insurance companies now face no risk. We should all be starting health insurance companies if we're going to continue reinsurance because the state is picking up all of the risk by paying 80% of all claims over $50,000. We cannot continue this program. We have to look at more sustainable programs that address healthcare costs. So, members, I urge you to vote no on the motion.
The member from Hennepin, Representative Cleavorn.
Thank you, Madam Speaker and members. Prior to coming here, I was one of those small percentage of individuals who purchased on the individual market. Both my husband and I are self-employed, and I actually was affected by the legislation which was passed and carried. As a mediator, I know that there are two sides to every story we tell. It's unfortunate that Representative Doubt has left the room. I'd like him to hear what I have to say. Yes, it's true, my premium went down. I paid $1,501 a month for my husband and I to have health insurance under the old plan. With reinsurance, I paid $1,321 a month. Now, the flip side of that story that no one is talking about in this room, except for you, Representative Munson, who mentioned it, what happened to our deductibles? Our deductibles doubled. We went from $68.95 a year to $14,000 a year. There is no affordable plan for a 59-year-old woman and a 62-year-old man on the individual market. When I was door knocking, it was about health care. I live in a community where we have lots of consultants, lots of small business owners who purchase on the individual market. They cannot continue to buy health care on the individual market. Reinsurance was a bogus promise, and that's why I'm here today. We want and we demand health care for everyone, no matter your socioeconomic status. It's a right in this country to be able to be seen by a doctor when you need care. I urge you to defeat this amendment. Thank you.
The member from Dakota, Representative Halverson.
Thank you, Madam Speaker. And I was on the reinsurance bill a few years ago. I was on the conference committee. I didn't support the plan that came forward, but it was a Band-Aid. And that's what its job was, to be a Band-Aid. We're going to just do a little stabilization and then work on true health care reform. And I carried the reinsurance bill. I'm carrying the reinsurance bill this session as well, as a start of a conversation, because we needed time to start working on reform. And when I sat in committee, I said, reinsurance is not health care reform. I cannot be more clear about that. It is not a plan that is proven and works. Reinsurance was a Band-Aid because the federal government stopped doing their job. This was a federal program. And Senator Rubio led the charge in making sure that we were not stabilizing state markets at the federal level. And so states had to step up, and states had to be responsive. And Madam Speaker, I have to stop and recognize my colleagues in this body on this side of the aisle who were asked to yield. And we're told directly and indirectly that they don't know their communities and they don't know this issue. To hear somebody say that to a medical doctor in this chamber is frustrating and insulting. We have to stop the practice of questioning motives. To have my motive questioned because of a job that I had 12 years ago is inappropriate. Members, we were elected to this chamber. Look at the room we sit in. The day that I was sworn in for the first time, my dad sat with me on this floor, as he had with his own father when he was a child. And he took a deep breath and he said, "Boy, when you sit here, you know you're supposed to be doing important work." And we are. We're not supposed to be treating each other that way. And for somebody to stand up and ask member after member to yield to tell them what they don't know is inappropriate. We all got here the same way. We all carry an election certificate to represent our district to the best of our ability. And do you know what I know from my 6 years or however many years I've been here? 7? I know that everybody that's in this room is committed to representing their district. And I would never question the way somebody chooses to represent their district. I am grateful for all of the work that you do to help me learn more about your district in the state of Minnesota. So, Madam Speaker, I had to address that. Enough, members. Back to health care reform. When we passed reinsurance as a Band-Aid, and I say we didn't, it wasn't a bipartisan effort in the end, but it went into place, and there was some results from that, and we were able to take a breath. There were some Minnesotans that were able to take a breath And during that time when we were able to take a breath, do you know what we needed to be doing? We needed to be doing healthcare reform. We needed to be tackling the underlying costs of healthcare, because I'm here to tell you, insurance is not healthcare. Insurance is a path to healthcare for Minnesotans. It's not healthcare, and it doesn't always guarantee access. So you know what the work we needed to be doing was? Guaranteeing access to Minnesotans for healthcare, using our healthcare access fund, protecting our healthcare access fund to make sure it was there, to do the job it was supposed to do, expand access to Minnesotans. And so, yes, we have bills this year to protect the Minnesota Healthcare Access Fund. We're supposed to be in committee right now having a nice long discussion about that, because we like good, thoughtful debate and discussion. But we're here, so we'll have this discussion here. And there are bills in committee now being debated to protect our healthcare access fund, to make sure that this historic fund that was put in place to make sure that Minnesotans could access healthcare stayed stable. And we have been hearing bills in committee. I don't know about you, but I am doggone tired. First deadline was exhausting, because we were here in committee talking about how to lower the price of insulin for people with diabetes, who have seen 1,000% increases in the price of their drug that isn't optional. It keeps them alive. And when people try to game the system and say, I'm going to use just a little bit less insulin, we saw a mother in our state lose her son. Those are the bills that we're working on. That's healthcare reform. Price transparency is a huge issue when it comes to prescription drugs. And I have a bill, and others have bills, to start to peel back that mystery in our healthcare system. Why is it that drugs can increase 1,000% and none of us know why, and none of us get a better result, and none of us get better access to our medicines? The only thing that happens is that people get richer and stockholders get to line their pockets. So yes, we're working on bills for that. We're working on bills to make sure that the drug pipeline with regard to PBMs are transparent, and we have a medical doctor in our body who is doing that work in conjunction with a medical doctor in another body from another party, doing good bipartisan work to increase our understanding of the way that the PBMs work and the way that they impact the cost to patients. Just this week, we sat in this chamber and debated the opioid bill. And we had to talk about the cost to our communities of opioids and the way opioids were marketed to patients and the toll that this has taken on our communities, on our budgets in local counties, on our state budget. And we heard a lot of defense for pricing, you know, and access, and not reining in, and not providing oversight and accountability with regard to how these deadly drugs are prescribed and marketed in our state. That's a healthcare cost issue. That's about bringing the cost of healthcare down. This is the work that we need to be doing. This is the vital work that is happening in our committees right now and that we're going to be debating on the floor. I expect to be here long hours. I'll be packing my suitcase, my overnight bag, ready for those debates, because they're important, and you're right, they need to be debated and discussed in the open. And anybody thinks that healthcare reform is a one-note song is singing the wrong tune. It's going to take all of us. It's going to take this bipartisan group that Representative Schultz mentioned. It's going to take creative thinkers. It's going to take everybody coming to the table. Providers, nurses, insurance companies, governments, to come up with solutions for Minnesotans. And it's going to take us talking to our constituents and making sure that we put a plan in place that works for Minnesotans, that works beyond 1 year or 2 years or 5 years. This is our legacy in the state as policymakers. Look back, members. Look back to the way we came together to make sure that Minnesotans had access to health care in this state. Look back to the way that we have defended our programs that got more Minnesotans covered, that got the lowest uninsured rate in the nation. Look at how we did that work. We did that work by being thoughtful, by working together, and by looking at a system-wide solution. It's time to sing another tune. Please vote against this motion.
The member from Sibley, Representative Grunhagen.
Oh, thank you, Madam Speaker and members. We are at a crisis. I agree everybody has a lot of passion about this issue. I've sold health insurance since 1978, and I did write a book in 2010 about Obamacare and predicted the mess we got here, okay? So I still have some copies left. I used to charge $5, but I'll give you a free one. But, because I could see it coming. But members, just a couple things that I'd like to mention. One is, on the reinsurance, insurance companies are still on part of the risk. What the reinsurance bill did, between $50 and $100 and $250,000, the government paid 80% of the cost, but the insurance companies were still on the risk for 20% of the cost. So they did have some risk, and therefore an incentive to manage the critical care of the patients who are having those types of claims. Number two, I hope my colleagues on the other side of the aisle understand why it's so important to keep a vibrant private health insurance market, especially in the individual market and also the small group. The reimbursement rates for private health insurance, according to a governor's task force in 2016, are 50% higher on average than government health insurance. Medicaid reimburses your doctors and hospitals at about 20 to 30% of their cost. Medicare about 30 to 40%, but private insurance reimburses at a much higher rate, even according to Governor Dayton's task force. And what you have to understand, why we need to pass this reinsurance bill, doctors and hospitals lose money on government reimbursement rates. So you don't want to just pass this reinsurance for insurance sake and lower premiums. You actually want to pass it to help our medical providers, especially in the rural area. If you do your homework, you will find that since Obamacare expanded government health care in the United States, we are now having the fastest closure of rural hospitals in 30 years with no end in sight. Members, think about that. The expansion of government health care, we're seeing the fastest closure of rural hospitals in 30 years in our countries, in the U.S. Is that what we want, members? The plan that is offered here through reinsurance, and I want to thank Representative Halverson for authoring the bill, and I urge support for my good friend Representative Davids's motion. It will help the most people. The plan the governor has only helps the people that go through MNsure. We need to keep a vibrant private insurance market for the sake of the medical providers and access. To the degree that you hurt the private sector market, you're going to hurt the medical providers and see reduced access for patients at the doctor and hospital. By the way, the Minnesota Hospital Association reported, as further evidence of low government reimbursement, what it's doing. The Minnesota Hospital Association reported in 2016 that 39% of Minnesota hospitals are losing money. 39, that's almost 40%. 4 out of 10 hospitals are losing money. That's by the Minnesota Hospital Association. You expand government health care or continue to cripple the private health insurance market, you're going to see even more of that. So the reinsurance bill will cover the most people, keep the most private insurance in force, and give your medical providers a higher reimbursement rate. The governor's plan, unfortunately, according to the information I have, will only help about half that many people, and we're going to see further shrinkage of the private health insurance market. The result will be even more stress on our rural health care providers. Remember, I know we've done a lot of bantering back and forth here, but, you know, put that aside. Think about your constituents, think about your health care providers, think about the access they need, and also remember, private health insurance will reimburse doctors and hospitals on average at a much higher rate, 50% higher than government programs. Vote for your medical providers, vote for higher reimbursement, vote for access for your constituents and patients that need that care. If we continue expanding government health care, you're going to see a shrinkage of access in health care, a shrinkage of hospitals, and a shrinkage of the number of doctors. One of the comment is just do a little bit of homework also in the Star Tribune. 53%, according to the articles in the Star Tribune, of our doctors are experiencing burnout. Obamacare and more government is destroying the healthcare profession. 53% in a survey said they are burnt out and ready to leave the healthcare industry. Think about that, members. We're already projected to see a shortage of doctors. Now you burden them with even lower reimbursement rates, and then you burn them out with the government system. Members, vote for the reinsurance. You'll help the most people keep the private insurance market, and let's come to a consensus to keep private health insurance, not to destroy it and replace it with low reimbursement government insurance. There is a place for government health care, but not the expansion of it, not at this stage of our state. We've got one of the best health care systems in the state. Please set your personal preferences and partisan ideas aside and vote for this reinsurance. Again, I want to thank Representative Halverson for carrying this, and members, I urge a green vote. Thank you.
The member from Douglas, Representative Franson.
Thank you, Madam Speaker and members. You know, it's so odd. I was listening to Representative Halverson, and she said, mentioned that maybe we need to start singing a new tune in this body, and maybe that tune needs to be the Twilight Zone. Because I'd like to remind everyone in this chamber why we were even talking about this today. There was a total control of government by Democrats in 2013 or 2012. Yes, 2013, 2014. We had total control of government. And that's where Democrats gave us this problem. Democrats forced MNsure on Minnesotans. They forced MNsure on each and every one of our constituents in the state of Minnesota. We were fine before MNsure. We were just fine. And now this state is a mess, and here we are today. Representative Halverson, you said to also look back, and I did. I went and reread an update from November 18th, 2013, titled, Minnesotans' Obamacare is Failing Minnesota Taxpayers. And in that update, I'll just quickly read a couple statements here. Taxpayers in Minnesota can't afford to pay even more for the implementation of Obamacare by Governor Dayton and Democrat legislators. Even those who aren't enrolled through MNsure are seeing costs go up. It's been reported that as many as 1 in 20 Minnesotans will be forced to give up policies they like with doctors of their own choosing for policies that will be more expensive and involve services they do not want. I also continue to say Governor Dayton and Democrats' chaotic implementation of Obamacare in Minnesota has resulted in higher costs, fewer choices, and serious privacy concerns for consumers. President Obama's politically motivated fix to his broken promise that people could keep their insurance may be too little, too late for hardworking Minnesotans. And here we are today, the twilight zone. Members, vote for the motion.
The member from Hennepin, Representative Hertaus.
Thank you, Madam Speaker. Members, I bet if I asked a show of hands who could remember the Medicare debates of the Johnson and Kennedy years, there'd be very few hands that go up. And with respect to health care, it's important to understand that although government has good intentions, when it comes to health care, Medicare in particular, and government in particular, doesn't know how to price risk. That's the sad reality of it. So the promises were made to a generation of retirees in the early 60s that when you retire, you have some type of a safety net, that you deserve to be comfortable in your old age and not go broke with your first illness. Well, back then, people didn't live as long as they do today. And fast forward just a decade later, little did I know that I'd be married, I'd be a young coronary care nurse married to another nurse, that we'd be raising a family. And our second born was a sick baby. And being we were in healthcare, we knew that we had a responsibility to make sure that we would be protected. So with that, and amazingly at that time, the average daily room rate in a hospital, in a Twin City hospital, was $60 a day in 1978. $60 a day. The intensive care room rate was usually about 50% more. So while my wife was pregnant with our second child, I thought it was responsible to make sure that I had adequate coverage just in case something went wrong. So I increased my intensive care room rate with my policy to $110 a day. Well, we didn't have ultrasounds back then. We didn't know things were maybe going wrong, but we were born with a sick baby. And so the neonatal intensive care room rate in 1978 was $350 a day at Children's Health Center. The internal policy was limited to one doctor visit a day. There were some other restrictions. But you know what? It came to my attention back then in 1978 just how corrupted this Medicare had become, because government didn't have the courage, as people were living longer and that we were having innovation in health care, that the cost of Medicare was going up. Congress never had the courage to raise the revenues to pay for those things. So what did they do? They started shifting cost payments to providers, starting paying fractional payments of fee-for-service to providers. It came to my attention because I was asked to pay for $60 a day for oxygen coming out of the wall. O2, an innocuous thing that we breathe every day. $60 a day. Let's translate that in terms of inflation. That's $600 a day for oxygen coming out of the wall. So one day at the isolette, there's a note on there. I need to go to the business office. Well, Mr. Hertaus, your insurance isn't going to pay for all this stuff. We need you to file bankruptcy so you can go to the state of Minnesota and we can get paid. I said, well, I'm a young businessman and bankruptcy isn't an option for me. So you're going to have to wait, because I was left with $60,000 of unpaid medical bills at that time, mostly due to cost shifting. Translate that to today, that's like $600,000. That'd be a pretty big mountain for a lot of people to dig out from underneath. Government doesn't know how to price risk. So here we are, talking about Medicare for all, multiplying that times 5 times the population. Government doesn't know how to price risk. I remember the debates when Medicare was going to be passed. Congress was up in arms about it because it was projected that by the year 2000, it might actually cost the nation $1 billion. Could you imagine that? Well, by the time we got to the year 2000, it actually cost $80 billion. Government knows how to price things really well. Members, there was a time in which we didn't buy health care. It was health insurance. You insured against catastrophic loss. That was what we did. If you went to the doctor, you didn't have a third-party payer paying for a doctor visit. You didn't have a third-party payer paying for prescription drugs. You got out your checkbook and you wrote a check. And by the way, most of them would even offer you a little discount. Even some dentists today do the same thing if you settle the account right here and now, today. No third-party payer, no waiting 60 to 90 days for the provider to get their payment. Folks, what's wrong with our system is people don't have skin in the game anymore. Sure, I want the best health care there is, as long as I don't have to pay for it. That's what we've reduced our society to, that we have a right and an entitlement to everything. Run the most amount of tests. Sure, doc, whatever you want to do, whatever you think, charge it to the public plan. We heard some members talk about price transparency, how true it is. You know, when ultrasounds came onto the market, suddenly every woman was probably carrying twins. They needed an ultrasound. That's the way things have gone in terms of innovation and all of the other types of services. When I was a young healthcare provider, I would have to say to you that absent innovation, not much has changed with regard to the general slide in the direction of healthcare, that our whole pricing system has become so corrupted. And so those providers, like I explained to you with the oxygen coming out of the wall or some of these other internal limits, providers had no choice other than to raise the prices just ridiculously high wherever they could generate the revenue to make the books balance. That's the sad reality of it all. And slowly and surely, that got shifted entirely onto the private market, which means Congress got away with letting there be a tax on everybody else who wasn't covered by insurance by letting their premiums go sky high. So here we are 45 years later, 55 years later. This is not the right answer. We need to do everything we can do, as you've heard, to preserve the individual market, to provide options, provide choices. And when the ACA was passed, if you're going to make every insurance policy be exactly the same, it drives the cost up. There's some people in this room that probably don't need maternity coverage anymore. Or maybe they don't want to have psych care or other options that are available. So the great lie when you heard Mr. Gruber, who was the architect of Obamacare, talk about if you like your plan, you're going to be able to keep your plan. I'd been paying on the individual market as a self-employed my entire lifetime. And I said to my wife, I said, you know, I think what's going to happen here is we like our plan, but we're not going to be able to keep our plan because the plan won't be offered anymore. And that's exactly what happened. To conform to the ACA, they had to change the plan, so it wasn't the same plan. I could go on for 10 more minutes, but I won't. I'm very passionate about how necessary it is to preserve the individual market. Members, Medicare for all, Medicare for the entire nation, the entire population is not the answer. Because government, again, I've said it repeatedly, does not know how to price risk, and we're going to find ourselves bankrupt as a nation. We're already trillions and trillions and trillions of dollars in debt. This is something that we can't sustain. Members, please support the amendment. I'm sorry, not the amendment, but the motion. And please vote green. We need to have a serious debate about preserving the individual market. Thank you.
The member from Olmsted, Representative Quam.
Thank you, Madam Speaker and members, and I'll try to walk us back to the business before us, which is the motion to put that bill on the General Registry. I got up because Representative Munson got up and was a prime example of passion and assumptions. And frankly, we've got a lot of members that weren't around when we had Chair Huntley, Chair Abler, Chair Gutwall, back before we have the current system that the national government put on us. Back when we had the good old days of Minnesota led with low uninsured rates, and most of the people that were uninsured were either available, they could sign up for a government program, they were in their 20s and 30s and invincible and didn't buy. And we had a good we had an MCHA, so that if you had a pre-existing condition, we had it set up to where it was affordable. And if you look at the cost curves, because I'm asking the new members, the members that haven't been around through this evolution, look at the cost curves for both premiums and in the last decade, the deductibles. And when someone says year to year went down 20%, look at the cost curves and what they would have been if you hadn't changed that curve. Because on average, everybody would have been up double digits. Now, people say, well, we don't like this option, that option. Frankly, Minnesota is not the big player in the national health care, whether it's medication or other issues. The federal government sets it. There is some influence maybe from some of the large populous states, but we can't wave our hands and automatically say our drugs are going to be 50% less. We don't have that power here. We do have the power to try, amongst the options that we've got to choose from, the best choice. We do have the responsibility to be informed. Look at what history has and make the best choice of the options we are restricted to. And usually it's good if you've seen something that actually has data on how it affected. Do I think and agree that there probably were a few that had their year-to-year premiums go up? Sure. But what would they have been if we hadn't done the program that we're asking to be put on the General Register, so then later we can debate on this floor? That's what we need to look at the math, look at the numbers, not the rhetoric. I'm not telling you any of our choices are the best that we possibly could do, but that the choices we have. And the people that I represent want me to look and choose the best option, even if there isn't a great one. We heard talk about access. And frankly, before, and I'm not going to call it the ACA, it was PPACA, Patient Protection Affordable Care Act. The first two seemed to get dropped off. And I had constituents that when we went to the newer system, their children and themselves didn't have the option of the same doctors that they had before. So access means network access. That's not directly to what this motion is, but that's part of what we have to work on. We brought up premiums and deductible, out of pocket. And if you aren't or haven't been or seen what the individual market over the last 10 years has gone to, you would be shocked. Because the increase in out-of-pocket, copay, deductible, everything else, I think has gone up more and at a higher rate than what the premiums were. Now, my first son was born, Minnesota led the nation with HMO and other things. It cost us $4 or $6, and that was for some baby aspirin or something like that, for the entire birth. We'll never see those days again. But what we can do is stop, look at the data, and make the best choices. And anyone that maybe hasn't been here 6, 8, 10 years, have a conversation with some of the people that were around, look at some of the information reports, and do the homework. And why are we hearing a motion to suspend rules to move to the General Registry? Well, frankly, it's not because we're tired because the time changed. It's because everything has a lead time. And the decisions we make have to be done with sufficient time so that it ripples into what the rates, the plans, the calculations are. So that's why some of us feel there's an urgency, because we know that if we wait until the end of session, it's not just the risk that we won't get something done, it's the risk that when we do it, it'll be too late for the actuaries and the whole process for that to ripple into the rates. So that brings us back to the reason for the motion, and that's to move forward and expedite consideration of a plan we actually know something about and debate it on the floor instead of why aren't we talking about it yet. So thank you for your time, and I hope you will support moving it to the register, which doesn't mean we'll be talking about it later tonight, but it does mean it's one step closer to doing the job that our citizens asked us to do. Thank you.
The representative from Wright, Representative Lucero.
Thank you, Madam Speaker. And I wanted to briefly respond to some remarks that Chair Halverson brought up. She mentioned the opioid bill from earlier this week, and she mentioned questioning members' motives. And I agree with her. And there was some closing remarks from the Majority Leader on that bill earlier this week that were really, in my opinion, out of line. And one of the things that I would hope that that side would do is take to heart what Chair Halverson spoke and speak to your own members as well about what votes mean. The remarks on Monday were something to the effect of what a green vote means and what a red vote means. That is out of line. What is appropriate to say is to urge members to vote red or green, but to interpret what the votes mean is a clear violation of the rules. And I would hope that the Majority Leader and other members on that side would have intellectual honesty and follow the rules, because not a single member in here knows what's in another member's head. And there are many reasons why a member will vote red or green. So as we go forward to the many bills, amendments, and motions that are going to be coming forward over the next several weeks, please keep that in mind, to follow the rules and not question another member's motives or why they are voting red or green. Thank you, Madam Speaker.
The member from Cottonwood, Representative Hamilton.
Thank you, Madam Speaker. Madam Speaker, can't we all just get along? You know what? We have the answers right here in this body. We do. And I'd first like to say, Chair Moran and Chair Liebling, you don't have to do it by yourself. You know what? There's many good bills out there addressing what the concerns are. I'll start with yours, Chair Liebling. You know, House File number 3. I'm doing my due diligence to try to understand that. There's a provision in there that actually reduces the role of pharmacy benefits managers as it pertains to some of the state programs. And it's, I believe, modeled after what the Republicans did in Ohio, because they too have wisened up to what has taken place and seeing the dollars that are being siphoned away from our healthcare system. That's part of a bill that I believe I can support. I'm going to encourage you to continue working on that as well, as I know you will. Vice Chair Mann, your bill as it pertains to licensing, I am going to stand shoulder to shoulder with you to get that to the governor's desk. There's a solution in there, absolutely. We have individuals practicing medicine without a license, and I can give you personal examples of what that means. You know what, Representative Munson? You are spot on. Transparency. Follow the money. My friend, I hope people were listening to what you have to say, because you are right on. Chair Davids, when we're talking about reinsurance, you know what? And I was called out for not supporting it initially, and you and I spoke, and I was concerned about some parameters. And Representative Halverson is bringing a bill to address some of those parameters and some of the reporting. But guess what? It did work. What you did, it worked. And it addressed what we needed to do at the time. Absolutely. And I think that we should be taking that into consideration. When we're talking about the ADA and the criticism around the ADA, well, guess what? When you have a pre-existing condition, you're pretty fortunate that that is actually passed. When I hear about insurance companies looking to do things to offset risks, I'm going to share you 2 examples of offsetting risk. First was the first prescription that I was denied that had to do to address my fatigue, and I was able to exercise along with that prescription that I was denied, and it threw me in a tailspin, and it ended me up in a wheelchair. Well, how did saving $37 of my own money per month, because I paid 100% of that cost, how did that, denying me of that medication, offset costs or save costs when they had to turn around and buy about a $5,000 wheelchair? It made absolutely no sense, but it happened. Another thing, my MS, I go in once a month for my Tysabri treatment. Once a month. The wonderful people right down the street here at Health Partners, I go in there, it's infusion therapy. I've been on it for about 7 years now. And my doctors at the Mayo Clinic said that it is keeping my MS at bay, meaning I haven't had major flare-ups because of this. So it's been working. I was told that the price, or I knew that the price was $7,500 a month, up to about a month ago. It jumped from $7,500 to $15,000. Somebody please explain that to me. Nobody can. But last October, I was prior authed. I went in, I had my treatment done like I always did. About 2 weeks later, my wife comes home, throws the mail down. I'm sitting at the kitchen counter, or the kitchen island that we have. She opens up the top letter and she just starts crying. I said, "What's the matter?" She throws the letter in front of me. I read it, and it says, "Denied." Not only did the insurance company and the pharmacy benefits managers deny my treatments going forward, but they denied the one that I just received. And they said the expense was on me. I turned to my wife and I said, "I'll take care of it." And she goes, "I know you will." Sorry. She says, "I know you will. But why does it have to be so difficult?" I then started making phone calls. And 2 of my first phone calls back then were the chair, Matt Dean, sat right over here, who I love dearly, and Chair Abler. And both of them said, "We'll do what we can to help you out," right? Because we all have feelings for one another. My next call was to the Mayo Clinic, and when I talked to my contact at the Mayo Clinic, and I explained to them what was taking place about my being denied, her response was, "Oh, yeah." I said, "Diane," I said, "that's your response?" She said, "Mr. Hamilton, This happens all the time where people are being denied. And people are being harmed. Real people, our constituents, are being harmed with the current system. This cannot continue. So, Madam Speaker, we have the answers right here. And it's not a partisan issue. It's a combination of all the ideas that are being presented. And if we can just lower the rhetoric and have a thoughtful conversation around this, we can come up with the solutions. We have them. So my promise to you on the other side of the aisle is I want to be part of the solution. And I will work with Chair Moran. I will work with Chair Liebling. And I ask that you do the same, which I know you will. Work with us over here. Friends, I'm one example. One example of many. We can do this if we simply work together. Thank you, Madam Speaker.
The member from Hennepin, Representative Winkler.
Madam Speaker, members, as Representative Hamilton, I think, so eloquently and movingly said, no debate this session or almost any session is more important to be thoughtful and serious about than health care. It is goes directly to the core of our financial well-being, our health, obviously, the health and safety of our family members, our children. I have a 12-year-old with type 1 diabetes, and you know, as somebody who certainly can afford to care for him today and make sure that he has good insurance, I know that it will be important for the rest of his life to have access to affordable health insurance, affordable insulin. Insurance is part of the solution historically to these issues, and we've been going through a serious change over time. Health insurance costs have been rising for decades. Long before the Affordable Care Act, health insurance costs were rising. It's not all at the fault of Medicare or the government. We have enormous pharmaceutical companies making enormous profits. We spent all day Monday talking about that. We pay health insurance providers much more than any other places in the world pay them. We have medical device companies here in Minnesota that make lots of money for shareholders. A lot of people, almost everyone in healthcare in America is making a lot of money. And the challenge for the system is how do we bring down costs? That requires a very serious and thoughtful debate. This motion today, members, does not advance a serious and thoughtful debate. Today we have spent 2 hours on the floor discussing a motion to move a bill from committee to the floor. It won't pass as a result of this motion. It's just a debate. It's just a discussion. Meanwhile, a committee was scheduled to meet during this time to discuss the impact of the Healthcare Access Fund of the provider tax going away and what will happen to people's health insurance and long-term care in Minnesota. That would be a serious and thoughtful debate to have today. We could have a serious and thoughtful debate throughout the whole session about how to address this issue. This will not be changed in 1 year. Reinsurance does not solve health care. The governor's plan, in our opinion, is a much better approach to this one issue of the individual market and costs running out of control in that one part of the health insurance market. But the challenges for health insurance, health care, are enormous. They are generational. They will take many legislative sessions, many discussions in committee to get this done. This motion will not move us forward one bit. So, members, I would ask us to focus the work where it belongs. I think Representative Liebling will be reconvening her committee tonight to talk about the Healthcare Access Fund. I think members who displayed such passion and interest on the issue today on the floor might benefit from attending that hearing. Last night, they learned that the governor's reinsurance plan, will help more people. It will reduce out-of-pocket costs for more people, and it will help the sickest people afford their coverage better, and it will bring $96 million into the federal government for Minnesota Care, which insures thousands and thousands of our constituents. If we attend hearings and learn about the bills that are being considered in the proposals, we could have a serious and thoughtful debate on the floor when the bills finally come through the committee process and for a final vote. So, members, I would urge us to spend our time doing homework and learning in committee not to make motions on the floor which will not advance anything, but do serve as a serious distraction for the real work that needs to be done. Members, I would ask you to vote red.
The maker of the motion, the member from Fillmore, Representative Davids.
Well, thank you, Madam Speaker and members. This was not a distraction. This is a serious motion on a very serious issue. I did agree with something that Representative Schultz said when she said this should be debated in committee. Please talk to the person on your left. Yeah, she's probably a little bit to your left. Yeah, talk to the person on your left, and let's debate this in committee. This motion is here because the minority is being stifled. We are being shut out. We need to talk about reinsurance. The bill for reinsurance, as my good friend from Olmsted said, is not going to be heard in committee. That's why we are here. I'd like to clear just a couple things up. First of all, this is a very momentous day because you have most of the Republicans over here fighting for a DFL bill. Write this one down in the books, because that's what we're doing. Chair Halverson has a great bill. Is it a Band-Aid? Yes. Does it take care of, does it address health care costs? No. Does the governor's plan address health care costs? No. That's not what we're doing in either bill here that I see. And so, members, these bills are not, we always talk about how do we pay for it, not why does it cost so much. And that's a debate I would like to delve in further with my friends on the other side of the aisle. Why are we here today with me feeling so strongly that we need to get this reinsurance bill going? Number one, because it worked. Let's have a little history here. Go back and listen to my speeches from 8, 9, 10 years ago on this floor and in Commerce Committee saying what Obamacare and MNsure would do to the individual market. People listen to those and say, man, Greg, you were really super smart. Well, I was at the top of my class, but it wasn't that big a class. But you didn't have to be smart to figure this out because Obamacare created adverse selection. Insurance 101, if you create adverse selection, the plan will not stand. That's all this is. That's all that happened. So 3 years ago, 2 years ago, we were put in a position where the individual market was gone. Commissioner Rothman said, if we don't do reinsurance, there's no individual market. I'm paraphrasing. That's basically what the Commerce Commissioner said. We had to do this. And Governor Dayton, with a lot of courage, let the bill become law without a signature. But let's get a couple of things straight. I've been hearing a lot of real misinformation from people just off the campaign trail saying that we have cut checks to insurance companies through reinsurance. My question is this: how many dollars have been sent to insurance companies from reinsurance to this day, the 20th of March? How many dollars? I'll tell you the answer: zero. What does the governor's plan do? Hires 51 people at MNsure, a failed system, to send checks directly to insurance companies. So let's get it straight. Let's get it straight. You're just reversed what the facts are. The reinsurance pool has sent nothing to insurance companies at this point. The governor's plan would send checks directly to insurance companies and take 51 people to do it. Why did we lose $150 million from the feds? Because MNsure could not determine eligibility. That's why we don't have the money, because the failed MNsure couldn't do their job. So, members, generally when I bring up a topic, it doesn't take this long. But I do appreciate the debate, because this debate's not over, but I hope people on the majority side will include the minority. We have a lot of good ideas. We had the reinsurance bill that actually worked. So please vote green, and let's move forward.
The clerk will take the roll. Members, please vote. The clerk will close the roll. Representative Erdahl votes aye. There being 46 ayes and 79 nays, the motion does not prevail. I'm tempted to ask how the dog is. Announcements. Representative Sundin.
Madam Chair, the manufactured modular home manufacturers are hosting a reception for all legislators down at the Capitol Ridge this evening.
Representative Liebling.
Thank you, Madam Speaker. Well, members, we will still have a hearing on the Healthcare Access Fund. We will learn, hopefully, a lot about how important that fund is to Minnesotans. So the Health and Human Services Finance Division will convene at 6:45 tonight in room 200 in the State Office Building.
Announcements. Representative Winkler.
Madam Speaker, I move that when the House adjourns today, it adjourns until 3:30 p.m. Thursday, March 21st, 2019.
Representative Winkler moves that when the House adjourns today, it adjourn until 3:30 p.m. Thursday, March 21st, 2019. All those in favor, please say aye. Aye. Those opposed, please say no. The motion prevails. Representative Winkler.
Madam Speaker, I move that the House do now adjourn.
Representative Winkler moves that the House do now adjourn. All those in favor, please say aye. Aye. Those opposed, please say no. The motion prevails. The House is adjourned until 3:30 p.m. Thursday, March 21st, 2019.